The only difference up here, from what I've noticed, is that there isn't a focus on higher education as much as there is on the East Coast, or at least in the Northeast, because nurses in New York City have high tuition reimbursement, which is something that nurses in many parts of California do not have. In fact, I was actually pretty surprised when I moved to California and realized that I was working with a lot of nurses who had their associate's degrees. And this is not something that I was used to seeing in New York City, because in New York City, most of these nurses have their bachelor's degrees at a bare minimum. And a lot of nurses actually have advanced degrees, because when nurses apply for hospitals in New York City, many of these hospitals are requiring nurses that at a bare minimum have their bachelor's degrees. But let me go back to this union situation. The reason why unions are important, look what they did to the state of Oregon. They finally passed safe nurse-to-patient ratios, with not just nurse-to-patient ratios that are outlined in this law, but also ratios that pertain to CNAs, or certified nursing assistants. So these CNAs cannot get more than, I believe, 8 patients at a time, whereas before they could get upwards of 20, 30 patients. They've gone even above and beyond what the state of California has accomplished when it comes to nurse-to-patient ratios.